China to boost COVID vaccination for the elderly amid outbreak. China plans to accelerate its COVID-19 vaccination drive among the vulnerable older population, especially those over the age of 18, in an effort to wrap up the nagging inoculation progress amid record high infections since the pandemic started. The time interval for older individuals to receive booster doses has also been reduced from 6 to 3 months, according to the plan released today by the Epidemic Prevention arm of the State Council of China's cabinet. The document listed 6 domestically manufactured vaccine combinations, including the inhaled and recombinant protein vaccines as booster shots. People aged 16 and above are identified as high-risk groups for developing severe symptoms, while the risks are even higher for those over 18-year-old. Guo Yanhong, a senior official at the National Health Commission, said during a press conference today. While senior accounted for 35% of all severe COVID cases in China, more than half of them are vaccinated, according to official data published in March. The central authorities have now ordered local governments to make inoculation more convenient and accessible for older people, while boosting vaccination efforts in nursing homes, activity centers, and other public venues. Though China has vaccinated the vast majority of its people, the country has fallen short of getting the shots into the arms of its older people as of Wednesday. Around 86% of those aged 16 and above had received a 2-dose regimen, and 36% of those over 18 had completed the same course. The vaccination campaign, especially for booster doses, has slowed in the past months, while the number of over 13s getting a booster shot edged from 146.6 million to 118.5 million between April and November. The figure of over 18s rose marginally from 13.8% to 14% from July to November, according to the National Health Commission, though experts and officials have made reassurance that vaccinations could prevent the elderly from serious illness after being infected with COVID. Many remain skeptical amid claims of possible adverse reactions. Experts have rejected posts made online companies claiming that the vaccine could cause health risks such as leukemia and diabetes. Meanwhile, the vaccination drive has been overshadowed by local coronavirus outbreaks, with many places struggling to contain the surges. Domestic media reported China has been an uptick of COVID-19 cases since October, with cases reaching a pandemic high last week. China began to more strongly push for the elderly to get vaccinated against COVID after a Omicron wave in Hong Kong earlier this year showed the risk posed to the unvaccinated older population, the state councils move on two-day came just weeks after the country revised its anti-COVID policy, promising to ease curves, though many places are still under lockdowns or other restrictions amid recent cases.